If I look at people and ask them how satisfied they are with their pain treatment, I think there's an inverse correlation with whether they're on opioids or not. And the higher the dose of opioids, the less satisfied they are. So I, in general, don't think that they're great treatment. I think they're reserved for a small subset. There's a small subset that work well. And I still think that the things that work the best are the things that I was taught when I was in training as a pain provider, which is ask the patient about how their life is different because of their pain, find out the things they can't do, work on things you can correct, help them get their sleep back in order, help find strategies to work on their mood, help them think about and reconceptualize the pain differently and decrease their fear of injury. Find some way to get them to use their body. We all live in our bodies. If you don't use your body, you can do less and less and less, and your world gets smaller and it has less meaning. So find something to do to get people to use their body. Those things are more important to me than whether I can use 80 or 100 milliequivalents of morphine opioid, in opioid dosing. So I find those approaches to be much more helpful. So I think that the ideas of the CDC guidelines are good, implementing them challenging. So what I would say is look broadly at your patient. Look at their overall quality of life, their overall functioning, their overall mental health, and think of ways to improve each of those things and turn the steps from I want to be pain-free and escape and have no responsibility to, hey, what can we do to partner together to get you to be able to do these things that are important to you? Because that's how people make change and feel better. In general, when we give people pharmaceuticals as treatment, we're taking away their role as an active participant in their health care. All they have to do to actively do that is fill the prescription and ingest it. That's not really an active participant in your care. So finding some way to get them to be more active in their health care and viewing, in general, medications as an adjuvant to other treatments which are more helpful potentially in the long run. No, that reduces pain numbers too. So if you have people with less distress and their body's in better shape, so now they can do more, they have less pain at the end of the day. And they do experience less pain. When you get in better shape, you have less pain. And when you sleep better, your pain tolerance is increased. And when your mood is improved, your pain tolerance is improved, and your pain experience is different. I mean, it's a complex thing, pain is. It's this mix of what's going on in the body and what's going on in your brain and what's going on in everything in your situation. I know about it. I have chronic knee pain. I wear a knee brace every day. If I don't wear my knee brace, I could not have walked around today like I did. If I wear my brace, it's fine. But my knee was way better after I strengthened my muscles. And I know I need to do the stretching exercise. If I don't do it, my knee really bothers me. So I can understand what it's like to have your life made smaller because of a pain problem. And it's important to think of strategies how to get there. The other thing that we didn't talk about is, procedures can be helpful. Using procedures incorrectly is a waste of resources and provides false hope and can have iatrogenic problems. But procedures, when the patient's pain is relatively focal, can be quite helpful to reduce that nociceptive drive, what's going on in from the periphery that's sending signals that become the pain experience. And it really can make a big difference. However, if all one does is the procedure and an injection, an ablation, stimulate something, without working on all those other things, it's not going to have as much of an impact as it would if you placed it in the context of a more comprehensive treatment approach. So all those things together reduce people's pain. I honestly think that what matters is patient stories and advocacy on a political level. So I think that state legislators and state legislatures are where there's influence possible, which is if for instance, I moved from one state to another state in the last 3 years, and when I did, the access of my patients to physical therapy improved, including those that were on state-sponsored insurance, is because there's a policy in the state where I live now that says you have to provide at least a baseline of this. So that's a political decision. So maybe that's the venue to turn to say we really need to have, if we're looking after the health of the citizens of our state, that has to include more than just providing cheap opioids or anti-inflammatory drugs or whatever it is.